psychosomatic disorder in general clinical practice, psychotherapy, psychohygiene, and psychoprophylaxis. The main components, the main group of our lecture. The objectives of our lecture, there are several objectives. First of all, it's to learn how to consider psychosomatic relationship in diagnosis, in treatment, and prevention of somatic disease. The main idea about close relation between the body and the soul, or between somatic health and mental health, have always been the leading issue of medicine. Hippocrates considered that it was necessary to treat the patient, not the illness. That is to say, a holistic approach to diagnosis and treatment was very necessary. When we speak about relationship between somatic and mental health, it is very necessary to say that this relationship is responsible to distinguish the following types. First, it's the psychological factors. Psychological factors as the cause of somatic disease. It can sometimes we can, not sometimes, another name of the psychological factor is a proper psychosomatic disease. The second type of studying the relationship between soul and mental, it's a mental disorders which manifest with somatic symptoms, different symptoms and signs. In this case, of course, we mean somatization disorders. The next type of studying relationship between mental and internal organs, it's a mental consequences of somatic disease. In this type, we mean different psychic reaction to the effect of somatic disease, how we react to some therapeutic disorders or oncology and so on. It's a different form of psychic reaction. The next type is incidentally of simultaneous mental disorders and somatic disease. And the last one, it's a somatic complications of mental disorders. As you know, you have already successful passed psychiatric exam, and you should know that all psychiatric disorders, diseases combine with different somatic complications, somatic symptoms. And it's a very important factor for diagnosis and for treatment our patient. Among the changes in the somatic health caused by emotional impact, we can distinguish the next form of psychosomatic disorders. First of all, it's non-pathological psychosomatic reaction. Non-pathological means the main principle looks like a nosogenia. The next form of psychosomatic diseases, it's like a classical psychosomatic disease. It's a classical diagnostic criteria for psychosomatic disease. And the last one is the influence of the emotional state of the development and cause of somatization disorders. As you know, as you remember, psychosomatic disorders, somatization reactions, and psychological reactions, they are closely connected with each other. And the biggest problem for that to diagnose psychosomatic disease in this relationship between these symptoms, because very often hard to differentiate symptoms. Is it psychosomatization disorder, or it can be, for example, cardiovascular pathology? Because of this, you must learn all small details of psychiatric disorders or therapeutic disorders, and know the whole complex of symptoms. When we speak about psychosomatic disorders, we should pay our attention that there is no common idea about the origin of the psychosomatic disease, their pathogenesis, and their treatment. So no common idea of the psychosomatic disorders. Psychosomatic medicine in general, yes, we should discuss psychosomatic medicine, the general concept of the psychosomatic medicine. So psychosomatic medicine began to develop very quickly at the beginning of the 20th century. Millions of cases of so-called functional patients were registered at that time, I mean the 20th century. The somatic compliance of these functional patients were not confirmed by the objective studies, by the objective symptoms and methods of diagnosis and so on, or it couldn't treat with the traditional drugs, with the traditional schemes of the management, and so on. At first, correction of the affective states and disorders in the interpersonal relations of the patients, that is psychotherapy, mental consultation, and these two components, they were very necessary. As you remember, when we spoke about psychiatric disorders as neurotic stress-related disorders, we discussed the very important questions of management, that management must be complex, and it's very necessary to combine pharmacological management, drug management with the psychotherapy or consultation as you want. You can't help your patient without psychotherapy. It is a necessary group of management, especially for neurotic stress-related disorders. When we speak about different form of psychotherapy, of just consulting, it's necessary to say that representatives of psychoanalysis explain psychosomatic pathology, emphasizing the prevail of forcing out of emotional experience. And this emotional experience later manifests with the somatic symptoms and signs in the patients with the psychosomatic signs. As you remember, neurotic stress-related disorders includes one group of disorders called dissociative disorders. And the basic concept of dissociative disorders, that's the forcing out of emotional experience. It's a stressful emotional experience. It's a very painful emotional experience, and they try to forcing out in the unconsciousness way using these methods, using these forms, and it can be basis for neurotic stress-related disorders. Scientific validation of psychosomatic relations can be found in the Pavlov's theory of conditional reflex. We should mention that some physiological and pathophysiological ideas, yes, in psychosomatic disorders, because it's very necessary. It's a basis of all diseases, and of course in the psychosomatic diseases. So besides Pavlov, there's another famous Russian neurophysiologist, Anokhin. He worked out in biological theory on functional systems. It is a concept about organization of the processes in the whole organism, which interacts with the environment. This theory regards the functions as achievement of an adaptation state by the organism and its interaction with the environment. According to this theory, any emotional reactions, functional theories, any emotional reaction is viewed as a holistic functional system. And this system combines with the brain cortex, with the subcortical structure and the respective regions of the body. This is the main concept, the main idea of the functional system, Anochin's functional theory. If we speak about psychosomatic disorders from the view of neurophysiology, we should mention that emotional processes involve both central system, hypothalamus system and limbic system structures of activation and rewarding, and so central and peripheral structures, yes. And in peripheral structures, of course, we should mention peripheral structures, catecholamines, adrenaline hormones, vegetative nervous system, and so on. Extreme in its force and duration irritants change the functional state of central and peripheral nervous system. With these functional disturbances, locus minoris resistentia. In the minoris resistentia, we mean, of course, different sites of minor resistance. And this minor resistance may develop, and it's very necessary, the main idea of this. There is a system of constant feedback with the determinants of the possibility of therapeutic actions on the emotional factors. Of course, unpleasant emotions, first of all, yes. Psychosomatic reactions. Psychosomatic reactions may appear not only in response to psychic emotional influence, but also to direct actions of the irritants. So-called a few of the lemon, for example, I told for some of my students, if you imagine some lemon, you should feel the taste of your tongue, this of lemons, your relationship with your emotional influence, and sometimes with your previous experience, with your memories, with your psychic reaction in general. Representations may influence the somatic health of the person, and it's very necessary. Psycho-emotional factors may cause the following psychological disturbances. You can see them in your screen. And these psychological disturbances can be in various organs or in systems of the organism in the whole. First of all, in the cardiovascular system. Cardiovascular system, the main characteristic is the increase of heartbeat or changes in the blood pressure or vascular spasm and so on. In the respiratory systems, we can mention different reactions like delay or like increased or decreased respiratory rate and so on. In the digestive system, there are some emotional factors, so there are some emotional reactions. There's a reaction. In the digestive system, we can mention about diarrhea, about constipation, about foaming, dryness in the mouth, and changing in the salivations, and so on. In the sexual sphere, we can cause of psycho-emotional factors can be increased erections or erection or weak erection, lubrication of the sex organs or anorgasmia in the whole. The next cause of psycho-emotional factors, it's the muscle spheres. In the muscles, it can be involuntary involuntary reactions. Yes, it can be muscular strain or tremor. And the last of one, it's a vegetative system. In the vegetative system, it can be precipitation or hyperemia and so on. Of course, there are a lot of other symptoms, but more common of them, these two. What is it psychosomatic disorder in general concept and the definitions and base idea of the psychosomatic disorders? There are different approaches how to define psychosomatic, and according different scientists, different form of scientific work define psychosomatic disorders from the opposite area, sometimes from the opposite idea. But for medical psychology, psychosomatic disorder or psychosomatics, it is a branch of medical psychology dealing with the study of physical factors and development of functional and organic somatic disorders. These definitions more useful in medical psychology. It's the main concept of medical psychology. Of course, therapists or psychiatrists or some other medicine specialists can define psychosomatic with their specific characteristic, but this one very informative for medical psychology. Psychosomatic disorders are those the origin and cause of which are carefully determined by psychological factors. And psychological factors are the basis concept for psychosomatic disorders. The cause of psychosomatic diseases is affective overstrain. Affective overstrain, we mean for, of course, emotional, yes, emotional reaction like conflicts or like fear or like rage. We have already discussed with you conflicts and fear in our previous lecture. So it can be the factors, yes, for psychosomatic disorders. And these factors, this cause of psychosomatic disorders, very important when defined personality features. And these personality features, they are very important in psychosomatic disorders. So combination of emotional overstrain, emotional symptoms, and they specific personality features, specific personality changes, and so on. Different psychological factors play a huge role in other diseases like migraines, like endocrine disorders, like malignant tumors, and so on. So we should know that psychological factors can be associated with psychosomatic disorders, but with the clinical therapeutic disorders too, and we should differentiate them. Nevertheless, it is important to distinguish true psychosomatic disorders, the development of which is determined by physical factors, and prevention should be aimed at elimination and correction of emotional overstrain. Emotional overstrain, of course, we mean psychotherapy and psychopharmacology, drug therapy, and the diseases, the development of which is also influenced by mental and behavioral factors, because they change non-specific organism resistance, but they are not the primary cause of the occurrence. For example, it is known that influence of psycho-emotional stress or stress reaction can decrease the immune reactivity, which increases the probability of disease. And very important now in our modern life, especially in the infections. You should know that, not you should know, I'm sure that you know that psycho-emotional stress can be the trigger sometimes to change immunity system, and as a result to have infection. So we should know this, and we should care about our patient in each medicine specialties, in each stages of management, and so on. Psychogenic components plays an active role in various organic disorders, like for example, hypertension, like myocardial infection, like migraine, like bronchial asthma, like colitis, like dermatitis, and ulcerative colitis, and like this. These diseases are frequently termed like a major psychosomatic disease. These groups, I mean hypertension, I mean gastric and duodenal ulcer, myocardial infarction, and so on. So, major psychosomatic disease. And these diseases, they increasing the severity of the disease and a leading role of psychogenic factors in the development of psychosomatic diseases. But what about true somatic disorders? When we speak about clear psychosomatic disorders, true psychosomatic disorders are characterized by the following factors. First of all, it's a psychic stress plays a key role in the origin of the psychosomatic disorder. First, stress, role of the stress, yes. Then, after its manifestation, I mean after manifestation of psychosomatic disorder, the disease becomes chronic or relapsing. Second criteria, and the third criteria, the first manifestation can be noted at any age, but chiefly in the teenagers, particularly in this period of the patient's life. This is three criteria of clear or true psychosomatic disorders. About clinical picture, classical clinical pictures of 7 diseases which we have already discussed, namely essential hypertension, ulcer, bronchial asthma, neurodermitis, thyrotoxicosis, ulcerative colitis, rheumatoid arthritis, and they are psychosomatic disorders. This is the main group of psychosomatic disorders. Psychosomatic disorders are the consequences of stress caused by prolonged mental traumas, inner conflicts between similar and in their intensity, but different in direction motives. So we can imagine the schemes like this. Yes, when psychosomatic disorders includes conflicts and prolonged mental trauma, stress. Some types of motivation conflicts are believed to be specific for defined diseases. Thus, hypertension is very often associated with a conflict between very strict social control of the behavior and unrealized need of power. So combination of two components can be the cause of hypertension. The unrealized need causes aggression, which cannot be manifested because of the social restrictions, and this can be the reason for hypertension or just cardiovascular system, pathology of cardiovascular system too. In contrast to neurosis, which based on intrapsychic conflicts. Psychosomatic disorders are characterized by dual forcing out of unacceptable motive and neurotic anxiety and neurotic behavior. So I just summarize. Neurosis consists of intrapsychic conflicts, which we have discussed in our previous lecture, and psychosomatic disorders. It's a forcing out of unacceptable motives, the basis, or neurotic anxiety, and so on. As it is important to understand the essence of protective psychological mechanism, therefore, it is necessary to characterize them. What is it, protective mechanism? Protective mechanisms are divided into primitive and more primitive sorry, I forgot how to call immature, yes. In primitive, it can be splitting, protection, identification, idealization, and more mature, like sublimation or rationalization mechanisms, mechanism of protection, I mean, of course. One group combines the types of protection which decrease the level of anxiety, but they don't change the character of stimulus. They are inhibition, or another name, forcing out from the conscious of unacceptable stimulus or feelings. For example, cognitive inhibition of craving is one of the cognitive control techniques practiced within standard cognitive behavior therapy to enhance the patient's ability to cope with the craving and prevent relapse. Similar strategies, along with the talking about the craving, are included in standard treatment protocols. The next mechanism in this group is denial. Denial of the source or feeling of anxiety. For example, many people use denial in their everyday, in their usual lives, to avoid dealing with the painful feelings or areas of their life they don't wish to admit. For example, student may refuse to recognize the obvious lack of preparedness for an exam. It's one of the main idea of the denial. Next mechanism is protection of transfer of the desires and feelings to the other. Because when the person admits both the seriousness and reality of an unpleasant fact, but blames someone else. For example, the cancer patient who has tumors might insist that his or her doctor is providing inadequate care, and that a different doctor could provide a different outcome. The next mechanism of protection is identification. Identification means mimicking the other person with ascribing his qualities. For example, if you remember Hemingway in his great poem, like the Green Hills of Africa, tells how he experiences a wounded mouth from the shock of the bullet to the end of his suffering. And next mechanism, it is inhibition. inhibition or blocking in the behavior and conscience, all manifestations which are associated with anxiety. If you are studying and checking your phone, chat with your friends, or go to the kitchen to get a study snack, your inhibition levels are lower than they might be during moments when you are studying hard and avoiding distractions, avoiding some important manifestations. One kind of inhibition protection mechanism. The other group unites the forms of protections in which the mechanism reducing the anxiety and changing the direction of the motives work and the genuine motives. For example, autoaggression. Autoaggression is the direction of the hostility to himself. The direct signs of autoaggression, when you need to sound the alarm, include suicidal attempts, refusal to eat, or self-inflicting bodily harm, like cuts, like beatings, and so on. The next mechanism, it is refashion. Refashion is the polar changes in the motives and feelings to the opposite, to another forms of mechanism. Next form is regression. Regression means decrease or turning to earlier childish forms of reactions, very childish. For example, a child going through a stressful divorce of his parents, may start fatting at the bent again as his previously ages. Next form is sublimation. Sublimation means transformation of the unacceptable forms of satisfaction of the needs to other forms less harmful. For example, a person who has an obsessive need for control and order becomes a successful business employer, or surgeon turns aggressive energies and deep desires to cut people into life-saving actions. It's a kind of sublimation, transformation forms. Transformation or sublimation, yes. The main forms of mental protections are the following. First of all, it's a forcing out. Forcing out, this is inhibition or exclusion of unpleasant or unacceptable events or phenomena from the consciousness, that is, removal of the moments. Information which cause anxiety. For example, in neurosis, main causative event is frequently forcing out. For example, the following psychological experiments are very, very interesting. The subjects were given the photo of specific conflict situation close to their experience, and the subjects were expected to describe them, but they seemed to forget the photos and put them aside. When the photos were given in the state of hypnosis, the protection was taken away and the photos caused the effective adequate to their content. Similar mechanism of protection is in the basis of a well-known phenomenon when the person notices somebody's errors and faults and forces out his own. In other experiments, the subjects were given tests on achieving success at doing some task. They recollected only those tasks which they had done correctly and forgot those which they had failed. It's a forcing out. The next mechanism, it is a substitution. Substitution means switching form of unpleasant causing anxiety experience to another, or not experience, for example, subject to another. This variety of psychological defense can be illustrated by the following experiment. After a conflict with the chief or a quarrel with the date, the person directs his anger to the members of the family. Very often when we use this mechanism. The person during an exciting talk crumples a sheet of the paper, or a girl when hearing a phrase, your boyfriend is always letting you down, throw away a cat sitting on her knees, and so on. It's examples of substitution. Next form is rationalization. This is an attempt to substantiate the desires and acts if recognition of their cause. They could threaten with loss of self-respect. As an example, and there are a lot of examples, for example, if a greedy person is asked to lend some money, he can always find a reason why he cannot do it. And if a person is unpleasant to you, you can always find a lot of shortcomings so you dislike may not be associated with them. The patient can explain his interest in medical literature with the necessity to broaden his outlook, and so on. It's a rationalization. Next one is protection. Protection in the form of protection is unconscious transfer of unacceptable feelings to another person, ascribing somebody's own socially inappropriate desires, motives, acts, qualities to the surrounding person. For example, it can be the behavior of a young, well-to-do man who placed his mother to the house for aged person and is indignant with the bad attitude of the personnel to her. To a certain degree, protection simplifies the behavior, excluding the necessity to evaluate the acts constantly. We frequently transfers our behavior to other people, protection out emotions to them. If a person quiet, sure of himself, well disposed, he thinks that the rest are also well disposed. A strained, frustrated person, unsatisfied in his wishes, is hostile, and protection his hostility to the other, to another person. It can be his friends, it can be his family, and so on. It's protection. Next one is somatization. Somatization is a form of protection, is expressed in exit from the difficult situation with a fixation on the state of health. For example, illness for test is the simplest example. In this case, benefit of the illness is significant. Increased attention and decreased demands of the relatives. In more severe causes, this form of protection becomes chronic as a rule. Exaggerated attention to the health and overestimation of the severity of the disease, including creating the own concept of the disease, are present. For example, here, very vivid hypochondriacal syndrome. Very often when hypochondriacal syndrome may develop in somatization. Next form is reactive formation. Reactive formation. In this cause, unacceptable tendencies are changed to the opposite ones. Thus, turned down love is often expressed in hated to the former object of love. Boys try to hurt the girls they love. The people who are secretly envious frequently cynically believe that they are true admirers of the person they are envious of. Next mechanism, it is sublimation. Sublimation, this is a form of psychological protection which characterized by transformation of unacceptable impulses to socially acceptable forms of instinctive requirements, which cannot be realized in an acceptable way out and the means of expressions. For example, some people hobbies are a way of realizing the most unbelievable motives, egoistic and even forbidden purposes can be sublimated with an activity in arts, literature, religion, science, aggressive or science, yes. Aggressive impulses, for example, can be sublimated in sports, and the best way to sublimate your aggression, wishes, actions. But proper psychological protection is meant when the person doesn't realize that his activity is determined by hidden impulses with biological and egoistic basis. Next form is regression. Regression, this is turning back to primitive forms of reactions and behavior. Especially frequently, this form of psychological protection is observed in children. For example, children without parents demonstrate the behavioral characteristic of development retardation. The child who began to walk suddenly stops to walk, or a neurosis which was present in infancy come back. We can mention a habit to suck the finger in difficult situation. Next form is negation. Negation, this is a protective mechanism which doesn't recognize but rejects impracticable desires or intentions, facts, and actions by unconscious negation of the experience. That is a real phenomena are believed to be not existing. It is very, very important to emphasize that negation isn't a conscious attempt to renounce, like in mimicking or lying. In the majority of real situations, several forms of psychological protection are usually used together. This should be taken into account by the doctors working both with the health and sick person. An unresolvable conflict of motives as well as uncontrolled stress caused capitulation, refusal from the search, which creates the background for development of psychosomatic disorders in the form of masked depression. Revealing psychological features which respond to development of psychosomatic diseases resulted in description of the features which are present in the patients with different diseases. These are reserve, anxiety, sensitivity, Below, we will describe the patients with defined psychosomatic disorders. First one, it is essential hypertension. Main properties of the personality prone to development of essential hypertension are interpersonal conflict, interpersonal strain between aggressive impulses on the one hand and feeling of dependencies on the other hand. Development of hypertension is due to the wish to manifest hostility at simultaneous need of passive and adaptive behavior. This conflict can be characterized as a conflict between contradictory personal rushes like honesty and sincerity in communication and politeness, avoidance of conflicts. At stress, such person can restrain his irritation and inhibit the desire to answer the offender. Suppression of negative emotions in the person during stress, which is combined by a natural increase in the blood pressure, can aggravate the condition and promote stroke development. When we speak about hypertension, example, very interesting example, the mental state in patients with arterial hypertension performed daily monitoring of the arterial pressure. This case demonstrates that at the early stage of arterial hypertension, after increase of arterial pressure, the patient reduces the level of anxiety. Thus, compensatory role of pressure elevation due to prolonged psycho-emotional strain was confirmed. At the beginning of hypertension disease, the majority of patients can adequately evaluate their state, perceive their administration adequately. Some suspicious patients think that increase in the blood pressure is a tragedy, is a catastrophe. Their mood is decreased, the attention is fixed on their sensations, the sphere of interest diminishes and is limited to the disease. In some patients, the diagnosis of the disease doesn't produce any reactions. They neglect the disease, refuse from the treatment. This attitude to the disease is observed chiefly in alcohol abuses, especially. When examining the mental state in hypertensive subjects with the daily monitoring of arterial pressure, determined the index of the arterial pressure, which can play a role in prognosis of mental disorders in the disease. These are high variability of the arterial pressure during the day and disturbances in the circadian rhythm of the pressure fluctuations, like increase or absence of night reduction in the blood pressure levels. The patients with hypertension should be explained the cause of their state. They should know that the disorders of the nervous system are functional, temporary, and with the proper treatment, the function will be restored. Next form of disease, it's a coronary artery disease. It has long been constricted that emotional stress can result in coronary artery disease. Coronary personality has been described in the literature. This idea is difficult to prove because only the perspective studies can distinguish psychic factors present before the heart disease and the consequences of the disease. In the studies performed in the 80s, the attention was paid to several groups of possible risk factors, which include chronic emotional disorders, social economic difficulties, fatigue, constant aggressions, as well as the behavioral pattern A. The most probable is pattern A, which is characterized by impatience, by excessive aspiration to competition, like work obsessed, like ambitions, aggressive, stressed, achievement orientated. When performing the studies devoted to primary and secondary prevention, main approach considered in elimination of such risk factors as smoking, irregular diet, incomplete physical load, and so on. Next form is angina. Angina means attacks of angina can be frequently induced to anger, anxiety, excitation. The sensations survived during the attack, angina attack, can be horrified. Sometimes the patient becomes too careful in spite of the doctor's efforts to make him get back to his ordinary lifestyle. Angina can be combined with atypical pain in the chest, edema due to anxiety and hyperventilation. In many causes, there is a discrepancy between the real capability of the patients to withstand the physical load determined objectively and their compliance of the pain in the chest and elimination of the activity. A good effect is produced by conservative treatment together with the adequate exercises. Some patients benefit from behavior therapy administered according to an individual plan of management. Next form, it's cardiophobia. You have already know what is it. One of psychovegetative syndromes, which is frequently observed in medical practice in cardiophobia. Discomfort and unusual sensations in the left side of the chest, which first occur in the situation damage the mental state, determined in the increasing anxiety of the patients and fixation on the activity of the heart, which increase the belief in the presence of the serious heart disease and fear of the death. Vital unbearable fear experienced by the patients with cardiovascular disorders cannot be combined with the ordinary sensation in their intensity and character. Feeling of a close death is the only reality for the patient. The obvious fact that dozens of attacks didn't cause infarction or cardiac failure doesn't mean anything, as it has long been known that it is dreadful to be dying not to due when the life of patients which died several times is tragic. Especially very important in this case is rational psychotherapy and suggestion. The life of the patient depends on their correct use and administration. Next form, it is apnea. Apnea, this is caused by numerous respiratory and cardiac disorders and can increase due to mental factors. In some cases, apnea is of purely psychological origin. A typical example of hyperventilation due to anxiety, it is apnea. The next one, it is asthma. The asthma is thought to be caused by unsolved emotional conflicts, and these emotional conflicts can be associated with the reactions of subordination, but the proofs for this are not satisfactory. It is asthma, sorry. In bronchial asthma, contradiction between desire of tenderness and fear of tenderness are noted. This conflict is described as a conflict progressive. Patients with bronchial asthma are frequently hysteric or hypochondriacal. They cannot realize their anger to the air and provoke attacks of suffocation. It is known that emotions like anger, fear, can produce and increase the attacks in asthma. It was reported that in children who had died of severe form of asthma, chronic mental and family problems had been noted more often than in the other asthma patients. Mental disorders. Mental disorders are not frequently in children with asthma than in the whole children population. But when these children have mental problems, they are more difficult to treat. There were several attempts to treat asthma using psychotherapy and behavioral therapy, but there are no convincing data suggesting the efficacy of these methods when compared with the ordinary advice and support. Only individual and family psychotherapy can benefit in treatment children with the asthma in case when the psychological factors are important. Next form is gastritis. Gastritis in patients with gastritis and ulcer, a specific character is formed in the childhood. These adult patients constantly need protection. They need support and guardianship. They respect force, independence, and strive for them. As a result, two opposite mutual exclusive needs like guardianship and independence collude with the cause unresolvable conflicts. Next form is ulcer. The patient with gastric and duodenal ulcer have specific features. They are often persons with explosive emotions. Their thinking is categorical, frank. The other group of the patient is not prone to external manifestation of emotions. They are frequently gloom, distrustful people. Some authors associate ulcer with the inappropriate self-presentation, need in protection. Strong prolonged effects, negative emotions such as constant fear, grief, fright at strained cortical activity can cause prolonged spasm of the blood vessels in the stomach walls. If the resistance of the mucous membrane to the actions of hyperacid gastric juice is low. It can result in also appearances. Further, development of also depends on both the above factors and appearance of pain impulses from interoceptors of the involved organs. Psychotherapy influences of the cause of the disease and the efficacy of treatment. Give me 1 second, please. So let's continue. Next form is colitis. Ulcerative colitis was noted to begin after experiencing loss of the object and catastrophe of experience, decreased self-estimation, excessive sensitivity to the fearless and strong desire of protection and dependence are characteristic of these patients. Give me 1 second, please. So this is colitis. Next form is neurodermatitis. Dermatitis. Eczema and psoriasis are considered to be neurodermatitis of psychosomatic origin. The patients are passive. They experience difficulties with the self-confirmation. It's a neurodermatitis. Diseases of the locomotor system. The patient with rheumatoid arthritis are characterized by stiffened and exaggerated position. They demonstrate high level of self-control. Characteristic is the tendency of self-sacrifice and exaggerated readiness to help the people with this disorder. They help has an aggressive character. I mean, patients with rheumatoid arthritis. The leading role in the treatment of psychosomatic disorders is played by general physician, but psychotherapy is also important for prevention of these diseases and at all stages of treatment and rehabilitation. Importance is revealing personal predisposition a prolonged personality-oriented psychotherapy. General physicians should train the patients with the skills of physics self-regulation, autogenic training for mobilizing and relaxation in stress situation. The approach to treatment of neurotic and somatoform disorders when the compliance of the patients are associated with functional somatic disease caused by mental disorders is different. In this case, the treatment is administered by a psychiatrist with the use of psychotherapy and psychopharmacotherapy, drug management. Next part of our lecture is psychohygiene. What does it mean, psychohygiene? Parts of psychology are systemized according to comparative age peculiarities of mentality. There are following aspects of psychohygiene. First of all, psychohygiene of childhood. Play activity, educational, training, sexual desire, youth, work, family, sexual life, and marriage. This is the main aspects of psychohygiene. Contemporary society is characterized by significant changes in human society, social activity. Thus, the requirements to his health and organization of his physical and intellectual functions are increased. Here, very important to mention mental health means. What does it mean? It's the absence of the evident mental frustrations. It is certain reserve of forces of the man with the help of which he can overcome stress, difficulties in unaccepted circumstances, and the condition of balance between a person and his environment in society, coexistence of the person's experience with the experiences of other people concerning objective reality. Next, please. It's a mental health. What does it mean, mental health? Mental health means absence of mental disease, means normal mental development. Dear students, please turn off sound of your microphone. Mm-hmm. So let's continue. Mental health. Mental health means, as I have already told, absence of mental disease, means normal mental development and desired functioning of supreme parts of CNS. For children, it means normal ability to master knowledge and skills, answer to requirements of school system, follow the norms of behavior in relations with the mentors and teachers. Normal development can be defined as a harmonic, appropriate to age, normal functioning and intellectual activity, positive emotional state. All these forms of mental health. According to the code of World Health Organization, health is defined not only as an absence of illness or physiological defects, but as a state of complete physical, spiritual, and social well-being. There are following components of the health: the physical, it is a mental, social, role, and general estimation of the health. I'm sure that you can make screen and you can read, not need to describe. It's very simple information. There are three interconnected aspects of health necessary for correct planning of biological measures and based on the appropriate levels of personality. It is somatic, it is mental, and spiritual. The spiritual aspects of health is a motivation for a healthy way of life, long and happy life, independent activity in formation and strengthening of person's health, careful attitude to life and health of others. There are 5 main groups of health. This health person with a normal development and normal function, healthy persons with a function of some morphological deviations and reduced resistance to acute and chronic diseases, patients with the chronic diseases in a condition of compensatory with the preserved functioning of organism, patients with a chronic disease in a condition of some compensatory with a reduced functioning ability, and patients with a chronic disease in a condition of decompensation. It's very necessary to know when you will build your plan of rehabilitation, psycho-rehabilitation. Yes, with which group you should work, and for each of these groups there are specific and very strict rules for work for psychohygiene. An important aspect of prenosological diagnosis in psychorehabilitation, we speak about prenosological diagnosis first of all, it's a recognition of the state of organism which are between norm and pathology. There are basic objects of prenosological diagnosis. It is chronic boundary or transitive condition of the organism. It's a being under strain, short-term and overstrain, and the fourth one, it's a state before the disease in the stage of an exhaustion of evolution mechanism with the homeostasis disturbances. The main task of psychohygiene is creation of favorable conditions for harmonic development and performance of all human mental abilities. I mean stable family, I mean normal meals, a good financial situation and house condition, and etc. So can be components of psychohygiene. About the second part and third, psychoprophylaxis and psychotherapy, let's discuss this topics, these ideas on our next lectures. And before we begin, I would like to ask you to take part in the research work, this research work that is being carried out at our department. To do this research work, you need to answer the questions presented in the Google form. I will send you now in the chat this Google form. Please answer for these questions, only 3 or 5 minutes, but these questions very important for me. We will be very grateful to you if you help us and may answer for this answer. And while I'm searching this Google form, I want to remind you to write down your name and your group number in the chat, okay? And when I will send you the link, please share this link with your friends and help us to share this link with maybe in your course with another course. We need a lot of students, okay, dear students?
Okay, madam.
Where is my chat? Look, I have sent for you the form. Do you see the link, dear students?
Yes, madam.
Okay. Please answer for these questions and share these links with your friends. Do you have any questions about our lecture?
No.
No?
No, doctor.